Hello and welcome to my channel. My name is Luis Ayas. Today we are going to talk about a very important topic and actually very common in the general population, not just in Parkinson's disease. I'm talking about anxiety. And let me start with this question. Do you know what is the main problem here? The main problem is that we don't like to talk about this because many people think it's a sign of weakness, or maybe because it's not socially acceptable. Believe me, it's not a sign of weakness. And the main reason for that is because your body follows your state of mind, which means that your body follows what is here in the computer, in your brain. I don't like to use the word, and actually I like to use the word get along instead of using fighting against anxiety, because that is not the point. Usually the concept of fighting against anxiety doesn't work. It is better to say get along or to think about how to have a good relationship with anxiety and to learn how to live with it. Believe me, if you suffer from anxiety, you will probably suffer from anxiety your whole life. The key here is to train your brain how to control the anxiety without resisting. And sometimes using anxiety as a weapon to improve your performance in many things in life, including dealing with a disease such as Parkinson's disease. If you try to fight back and resist this sensation, it's gonna get worse. It's like a quicksand. My point here is get along with anxiety no matter what. That's the most important thing here. So what is anxiety? Well, let me start saying that a certain level of anxiety is a common phenomenon. It's a sensation that we need to survive. However, when it's too much, excessively, then is when anxiety starts affecting our function. Remember that symptoms of anxiety, besides being worried too much, are the following. You can have, you actually can be very reactive, fearful, not able to stop thinking about things. For example, some patients tell me that they wake up in the middle of the night, 2 a.m., 3 a.m., and they cannot go back to sleep because the mind is like running, thinking and thinking and thinking, and they cannot stop thinking about things. Remember, anxiety could be symptoms of other disorders such as depression, problems with memory, just to name a few of them. Even dogs suffer from anxiety, believe me. I have a huge German Shepherd that gets very anxious when it's time to go to the bed. And it doesn't matter where, he knows. And I can tell very easy the level of anxiety. His alertness increase, even his pulse, breathing increase. This is a classic example of a maladaptive level of anxiety to a specific situation. My point here is anxiety is universal. Might be severe enough to affect your function, and that's a problem. The thing is that you are not alone. Anxiety is the most common mental illness in US. Approximately 18%, almost 20% of the population every year suffer from anxiety, affecting their function. And also anxiety is one of the most common non-motor symptoms in Parkinson's disease. So for example, approximately 20 to 50% of the patients with Parkinson's disease suffer from anxiety. And this number change depends which paper do you read, but more or less it's like 40% of the patients. Now, let's talk about why people with Parkinson's disease suffer from anxiety more than the general population. So there are three main reasons. Number one, it's a common reaction to the diagnosis. Okay, very common when your doctor, your provider tell you that you might have Parkinson's disease that might cause emotional stress, anxiety. The other reason is remember that in Parkinson's disease is not just deficiency in dopamine. We also have deficiency in other chemicals in the brain, such as serotonin. So this is why people with Parkinson's disease respond very well to medication. At least the majority of them respond very well. The other very important issue is that people with Parkinson's disease, especially when the anxiety happens usually at the same time, might be actually an off phenomenon, off period, which means that the medication, the levodopa, when I say levodopa, I mean the Ritalin, the Sinemet, is out of your system. And this is why it's very important to pay attention to that, because the way to treat anxiety as a off phenomenon is to adjust the medications. The good news is, as I mentioned before, anxiety responds very well to treatment, not just in people with Parkinson, the general population as well. So this is the few things that we can do. For example, it's very important that your doctor, your provider, rule out other conditions highly associated with anxiety. There are many other conditions, including metabolic issues, medication side effects, all these things. So other things that we should be paying attention is when you have anxiety, specifically, for example, you have anxiety, for example, every day at 7 p.m. or 6:30, 8 p.m., more or less in this range, might be related with an off phenomenon. So you need to make notes, pay attention to that, because like I say, anxiety could be an off time. So, and the way to treat that is adjusting your medication. Also, try to sleep well. It's very important. If you don't sleep well, things are not going to work well, okay? Other type of treatment that we have available and pretty effective is just how to train your brain. Training your brain, I mean talking therapy. We call that psychotherapy. Some people use music therapy. Some people use meditation. Very important. This is another main reason to do exercises, okay? Having a good routine of exercises, specifically yoga and anything that increases the heart rate, like aerobic exercises, is good for anxiety. Is another reason for that. This is a very nice study published in 2019. They compare two groups. They compare yoga and stretching resistant training exercises group, and then evaluate anxiety and depression. And they found that patients, both group actually improve the motor symptoms. When I say motor symptoms, I mean mobility, stiffness, slow movement. But yoga improves psychological stress and spiritual well-being, which is very interesting. Now, when all these things that we discussed are not working well, then we need to add medication. And usually patients need medications because it is a combination. So it's a combination of talking therapy, exercises, but also you need to keep a balance in chemicals in the brain. Remember what I said before, that Parkinson's disease is not just a disease of dopamine. Dopamine is one of the chemicals in the brain. There are other many chemicals in the brain that are affected in patients with Parkinson's disease. So these are the type of medication that we have available. One of them is a benzodiazepine. I usually stay away from benzodiazepines. There are many reasons for that, but this is a very common side effects that we have from benzodiazepine. The only time I will use benzodiazepine is when the patient are acting out during sleep. We call that REM sleep behavior disorder. This is mostly when I will certainly use REM sleep behavior, benzodiazepine, the long-acting clonazepam, and only when this problem, REM sleep behavior disorder, is affecting function. Otherwise, I don't even treat that. And I have a video about that. My first choice is melatonin, and if that doesn't work, I add clonazepam. One of the main side effects that you have with benzodiazepines, especially the short-acting one, like Xanax or alprazolam, is addiction. All of them might cause balance issues, worsening of your thinking process. We call that cognitive issues, and actually increase the risk of having falls, especially at night when you wake up to go to the bathroom. It's very common for people with Parkinson going to the bathroom to urinate multiple times, and you might fall. And one of the reasons for that is because you are taking benzodiazepines. And the problem with that is some patient might end up having a fracture. So that's not my first choice, but sometimes in the acute setting, especially when you just have a panic attack, you are very sensitive during the first few weeks after having a panic attack. So it might be reasonable to use some of this medication. Including lorazepam, alprazolam, or even clonazepam. These are my best, I consider my best options here in this setting. I like sertraline, which is Zoloft. People tolerate sertraline very, very well. I try always a low dose. I usually start with 25 milligrams for 1 week and then increase to 50. But usually patients require at least 100 milligrams to have some effect in the majority of the patient. There are some patients that with 50 milligrams would be enough, but usually this is not the norm. This is the exception. There are another type of family that we use is venlafaxine is one of them. Venlafaxine, I like venlafaxine. Venlafaxine tend to work very, very well as well. And people tolerate the medication pretty well. What is my final point? Get along with anxiety, but treat it. Remember, your body will follow your state of mind. If you like this video, don't forget to like, share, and subscribe to my channel. Thank you. See you soon.